So what happens after the baby's born? Let's say baby's on the mama's chest, the cord is still pulsing. So beside all the stuff between the mama and the baby, there's some choices and options that the woman has in terms of the cord. So many women are choosing to delay the clamping of the cord so that the blood that's in the placenta and the cord goes to the baby. That's called delayed cord clamping. It's something you can talk to your clients about. And then when the decision is made to separate the baby from the cord and the placenta, then the cord is clamped. And it's kind of a ritual. It's often offered to the partner to do, but the woman can do it. So does a person who gave birth to the baby feel like helping with the clamping of the cord and then the cutting of the cord, which is the separation in that way? So that's something that they can think about and choose to do. Somewhere in that same time, the uterus clamps down and the placenta is delivered. So the birth isn't done until the placenta is outside the body. Cord cut, and then the placenta is set aside. And the midwife or the doctor will examine it to make sure that it's intact. And another option that women have is to ask, can I see my placenta? Show me it. So sometimes doulas will do a placenta tour. You can watch Anzie's placenta tour because we'll include that video. Or just have a look at it. And in all the hospitals that I know of, the placenta will just be discarded. It's discarded in a certain way following protocol, but you can keep your placenta. So what do you do if you aren't going to leave your placenta to be discarded at the hospital? You can do a print or arrange for a print of the placenta. This isn't a print just of the placenta blood making the print. It's actually this one is used with acrylic paint because the person was not going to consume their placenta, but you can get food grade inks to use, colors and things to use to take a print of the placenta on any kind of medium. You can keep the placenta, freeze it until you decide what you're going to do with it. You can plant it or put it back to the earth. Many different cultures and traditions have really different ways that they view the placenta, the role of the placenta, appropriate ways of respecting the placenta. So that's individual to your client. But if she doesn't know that she has any options, then she doesn't have any options. So she can keep it, she can bury it, she can plant a tree or a bush, she can take it to her grandma's farm and plant it under the garden. Angie and I process placentas into capsules for the women to take in the postpartum, and the feedback is absolutely amazing in terms of the benefits of the minerals, iron, hormones that are available to her in the capsules. Some people keep the cord and dry the cord. There's all kinds of cultural traditions and rituals to do with that. Some people consume the placenta raw in smoothies, make tinctures of it. So what I'm just letting you know is the placenta is such a valuable organ. You have grown it yourself as you grow your baby. After the baby's born, placenta is delivered, and I just think it's worth thinking about how you want to complete the process in terms of the amazing placenta.